We are taking effort to make all these things for y'all. So please y'all also make an effort to like and press the bell icon and comment if you really liked it. Promote professionalism and trust. You uphold the reputation of your profession at all times. You should display a personal commitment to the standards of practice and behavior set out in the code. You should be a model of integrity and leadership for others to aspire to. This should lead to trust and confidence in the professions from patients, people receiving care, other health and care professionals, and public. The reputation, the professionalism should be maintained. How? Let's see. Uphold the reputation of your profession at all times. We should make sure that we are in a reputed profession, that is nursing, and we should be careful of anything what we do. Keep to and uphold the standards and values and set out in the code. Whatever values are there, principles are there, standards are there, we should be working according to it. Act with honesty and integrity at all times, treating people fairly and without discrimination, bullying, or harassment. We should treat with honesty, with integrity, treating people and not discriminating properly, and not discriminating anyone and treating people properly, fairly. Be aware at all times of how your behavior can affect and influence the behavior of other people. So you are in a team, you are in a setting where each of your movement or whatever you do, actions, it affects the people around you. So you should be cautious. Keep to the laws of the country in which you are practicing. Wherever you are working, according to the code, conduct, laws, you should be aware of it and work accordingly. Treat people in a way that does not take advantage of their vulnerability or cause them upset or distress. Some are sensitive, some are vulnerable. So accordingly, you have to treat them. Do not take advantage of anyone. Stay objective and have clear professional boundaries at all times with people in your care, including those who have been in your care in past, their families and carers. There should be a professional boundary. There should be a professional mannerism and conduct which has to be maintained even with your past patients. Make sure you do not express your personal beliefs, including political, religious, or moral beliefs, to people in an inappropriate way. Whatever are your personal beliefs, do not try to share them in an inappropriate manner. Act as a role model of professional behavior for students and newly qualified nurse, midwives, and nursing associates to aspire to. So these people, the nursing team, they will be looking at you. If they are newcomers, you should make sure that you behave in a proper manner so that they learn good things from you, a proper conduct from you according to the standards. Maintain the level of health you need to carry out. You need to carry out your professional role. So as a nurse, as a midwife, as a nursing associate, make sure you are also healthy and your health should be accordingly so that you can take all the responsibilities properly. Use all forms of communication, spoken, written, digital, including social media and networking sites, responsibly, respecting the right to privacy of others at all times. Whenever you are using any kind of communication, make sure that any patient's privacy, any colleagues is not hampered. You cannot disclose the information. You have to be careful. Next statement, uphold your position as a registered nurse, midwife, or nursing associate. You have to be taking care of your position. Yeah, refuse all but the most trivial gifts, favors, or hospitality, as accepting them could be interpreted as an attempt to gain preferential treatment. So, if any patient or anybody, if they try to give you gifts, try to refuse it so that uh, others will not think that you're giving them preference. Never ask for or accept loans from anyone in your care or anyone close to them. Do not ask for anything, any loans, any help of in terms of money or any kind to the people who you are taking care of. Act with honesty and integrity in any financial dealings you have with everyone you have professional relationship with, including people in your care. Honesty and integrity should be there in the financial matters. Make sure that any advertisement, publications, or make sure that any advertisements, publications, or published material you produce or have produced for your professional services are accurate, responsible, ethical, do not mislead or exploit vulnerabilities, and accurately reflect your relevant skills, expertise, and qualifications. So, whatever documentation or anything, publication or any material you publish or you give a record of, always it should be explicit. Yeah, do not use false thing. Never use your status as a registered nurse professional to promote causes that are not related to health. Do not use your status for undue advantage. Cooperate with media only when it is appropriate to do so, and then always protecting the confidentiality and dignity of people receiving treatment or care. Make sure that you don't disclose any information in media. You're not allowed to do it. Next statement is fulfill all registration requirements. How to keep it up with this? Keep to any reasonable request so we can oversee the registration process. Keep to our prescribed hours. Keep to our prescribed hours of practice and carry out continuing professional development activities. Keep your knowledge and skill up to date, taking part in appropriate and regular learning professional development activities that aim to maintain and develop your competence. You always keep on learning. Next is cooperate with all investigations and audits. This includes investigation or audits either against you or relating to others, whether individual or organization. It also includes cooperating with requests to act as a witness in an hearing that forms part of an investigation even after you have left the register. So you need to be a part of audit, even if it is against you or against any other person. Even if you are not working in the setting but you were at the time of the event, you should help as a witness. Cooperate with any audits of training record, registration record, or other relevant audits that we may want to carry out to make sure you are still fit to practice. You should provide a proper document or proper record so that the NMC can audit it properly, that you are capable to do the job or no. Tell both us and any employer as soon as you can about any question or charge against you, or if you have received a conditional discharge in relation to or have been found guilty of any criminal offense. You should always make sure that the criminal character or whatever is against you, it should be informed if it is. Tell any employers you work for if you have had practice restricted or had any other condition imposed on you by us or any other relevant body. So if you are restricted, you should inform that too. Tell us and your employers at the first reasonable opportunity if you are or have been disciplined by any regulatory or licensing organization including those who operate outside of the professional health and care environment. Anything you are restricted to do, anything you are not allowed to do, anything you don't have license of, you should always tell. Give your NMC pin when any reasonable request for it is made. Your NMC pin should be provided if you are requested to do it. Respond to any complaints made against you professionally. How can you do this? Never allow someone's complaint to affect the care that is provided to them. Like if any complaint is against you, you should not deal with it in a negative manner. Be professional, give the proper care to the concern, even if the complaint is raised by the particular person. Use all complaints as a form of feedback. Use an opportunity for reflection and learning to improve practice. Whatever the feedback is, learn from them instead of taking it in a negative manner. Next is provide leadership to make sure people's well-being is protected and to improve their experiences of healthcare and system. How can you do this? Identify priorities, manage time, staff and resources effectively, and deal with risk to make sure that the quality of care or service you deliver is maintained and improved, putting the needs of those receiving care or services first. When you're being a leader, you have to prioritize, identify the priorities, manage the staff, use their resources effectively. Properly, you have to use the resources, whatever you have, and give the best of best treatment. Support any staff you may be responsible for to follow the code at all times. They must have the knowledge, skills, and competence for safe practice and understand how to raise any concern. So as a leader, you should always educate whoever is working with you, all the codes, what are the standards, values, and principles of NMC, so that they can work accordingly, and they should know the line from if they have any doubt or if they have any concern, they should know where to go to any circumstance where the code has or could be broken. Throughout their career, all our registrants will have opportunity to demonstrate leadership qualities regardless of whether or not they occupy formal leadership positions. So whenever you're working as a nursing in a healthcare team, everybody gets the opportunity to do the leadership. So you should know all this, even if you're not given the position, but you're given the duty to do it, or you are supposed to act accordingly, do it. These were the code of conduct in the NMC code. So here we finish the code module of NMC, which is helpful for CBT examination. This content is from NMC, and this content was used by me for explanation of the points given in the content. You can use it for self-study and you can score well. So the 4 P's we have seen in whole of this module, you can find all the videos in the playlist for CBT, or else you can just check the description. You will find the links over there. Just go through it one by one and do your self-study.